ongoing manner. That's because those needs keep changing. The changes are caused by several factors, including shift in population due to expansion, seasonal fluctuation, age demographics, and new technologies such as MRI, laser surgery, at-home dialysis, and new outpatient services. Communications must be maintained with hospitals and other medical facilities to assure that they are receiving the highest quality service available in the industry today. Being involved with public service, community education is important. Working with community civic associations, people can be made aware of the general health care structure in their particular area and how an ambulance service supports that structure. The bottom line is, the only way Atlantic Ambulance Service can be truly responsive to both community and professional needs is to first understand those needs and to keep responding to those needs as they change.
As in most organizations, operations has the responsibility to provide the personnel and services that make it possible for the company to fulfill its basic mission. For a closer look, let's start as an incoming call is received. Atlantic Ambulance Services is one of the few services in the country that has two communications and dispatching staffs. One handles 911 emergency calls, and the other processes routine patient transfer calls. If a large-scale emergency requires it, both can be easily combined for immediate response. All communications traffic is recorded and retained for future reference. Just as communications and dispatch are separated, so too is the equipment. Some vehicles are designated for 911 response, while others are reserved for more routine transfers. This separation results in a very efficient response to the caller's needs. The nature of our service places a heavy demand on the equipment. All vehicle maintenance is done in-house by staff mechanics. Preventative maintenance is an important program here. When breakdowns do occur, a tow truck is dispatched immediately so that downtime is reduced. Additionally, backup ambulances are on standby to replace equipment that is down.
This office is responsible for dealing with our patients after their ambulance call, helping answer questions relating to our operation, private insurance carriers, or Medicare. In this room, we have more than a dozen patient service representatives helping with what sometimes seems like a dizzying array of medical paperwork. It's our job to make dealing with that paperwork as easy as possible. If any of our patients has any question relating to their call, the people in this room will get them the answer. Our data department is responsible for the computerization of much of the paperwork associated with an ambulance call. This department uses some of the latest in computer equipment and software developed by our in-house programming staff to automatically route paperwork. Like any organization, we have to respond to the needs of our patients. Responding to those needs in a rapid and courteous manner is and will always be the hallmark of Atlantic Ambulance.
This mission statement plaque is displayed at all our facilities. It reads, Atlantic Ambulance Service is committed to providing excellence in emergency medical treatment and transportation for the ill and injured in time of need. We will maintain professional relations of the highest order with all. We will treat our patients and associates with respect, kindness, and understanding at all times. To these ends, we are dedicated to selecting, training, and nurturing ourselves to assure excellence. Excellence in emergency medical services. Brought to you by Atlantic Ambulance Services and the people behind the services.